Hey folks, so what's the difference between a TY year, a transitional year, a prelim or preliminary year in internal medicine or in surgery, a categorical track residency spot, an advanced spot? So I got this question. Someone asked me, why didn't you go straight into radiology? Why are you doing a general surgery prelim year? What's the purpose of that? So I wanted to explain. So the first thing, the most common thing is categorical positions. This is a position where you match into a spot, and the contract, even though the contracts are renewed every year officially, but the understanding is that you're going to do intern year through graduation at this one place. So it could be general surgery, 5 years. It could be plastic surgery. It could be neurosurgery, 7 years. All categorical, one place. It could be orthopedics, 5 years in one place. You're an intern, you do some general surgery, which is not ortho, but you still finish off at that program the last 4 years just ortho, and you graduate from there. The other thing is advanced positions. An advanced position requires a prerequisite year of a prelim in internal medicine surgery or a transitional year. What does an advanced position mean? This is a position where when you start it, you have to apply for it separately than your prelim or your TY. It could be at a totally different hospital, totally different city, institution, university, whatever, or it could be at the same place. And it's advanced because it's only that specialty that you're doing your residency in. And the specialties are like ophthalmology, radiology, dermatology, gas, those are advanced, and they require a prelim or a TY year, although there are some cases where you can match categorical anesthesia, for example, because they have an integrated prelim or TY year at that place. For example, when I applied radiology, obviously I applied broadly. University of Minnesota, they had a TY year part of the match when you applied for their radiology program. So it was a categorical radiology residency in that they put you in with the TY residency, which was a different program director, different curriculum, different batch of matched residents, and some of them were going to go off to other specialties. And then after that year, you went into radiology with University of Minnesota. That's just an example. Now, what's a prelim? So the only purpose of a prelim is to either fulfill the prerequisites for an advanced position or to set you up to reapply. And that's the same thing for a TY. A prelim, you either do prelim internal medicine, which is, it's awards, okay? That's really what it means. Prelim internal medicine is wards, 1 year, almost 1 year of wards. You're going to get some elective mixed in. It's not going to be like 6 months of elective time. It's going to be like 2 months or something. You're going to do nights. You're going to do internal medicine as if you were a categorical internal medicine intern. You're going to do the same exact thing that they do. You're going to work a ton. You're going to write a bunch of notes. You're going to see admissions. You're going to see consults, whatever. You're going to staff with your attending, and hopefully it'll be a good experience for you. Why would you do a prelim internal medicine year? If you want to reapply to internal medicine, or if you want to reapply to any of the specialties, the advanced position specialties that require a prelim year, and you happen to want to do internal medicine for that year, or if it's something kind of related to internal medicine, like maybe derm would be more of an internal medicine prelim than surgery, for example. I mean, that's just my opinion. Now, a surgery prelim, it's the same thing, 1 year to meet the prerequisite requirement for an advanced specialty. It could be that specialty could be radiology, and maybe there's a preference if you have interest in interventional. That specialty could be anesthesia, it could be ophtho, or if you want to reapply to a surgical specialty, then obviously you would do a surgery prelim if you didn't match the first time. If you want to, the advantage of doing a prelim, this is very critical. The advantage of doing a prelim is it has the potential to count towards your categorical graduation, meaning that if I do a general surgery prelim and then I could find a PGY2 spot in general surgery and then go straight into PGY2. If I do a transitional year it doesn't count. I would have to start as an intern, again, in general surgery, if I matched into a categorical spot. The same thing with prelim IM. At my previous program where I did internal medicine, they had like 5 or 6 prelim IM people, obviously left. Some of them matched there. And they had the option to match as categorical interns and repeat intern year, or they had the option to apply broadly across the country and be PGY2s in internal medicine somewhere else. So the prelim has the opportunity of saving you a year if you are reapplying. A TY doesn't save you a year if you've already matched into the advanced specialty, which, remember, for the advanced, you apply for the TY or the prelim, prerequisite year, when you apply for the advanced specialty if you're a med student. In my case, I only applied to advanced radiology because I knew I fulfilled the prelim requirement. The other thing about surgery, so with surgery and medicine, I've already talked about like my schedule, my rotation, but with surgery, you will work. You're going to learn a lot. You're going to be expected to learn how to operate, learn how to close fascia, learn how to close skin, do dermals and subcuticulars and running, and do bedside procedures and things like that. Just like in internal medicine, you're expected to learn internal medicine stuff and how to treat COPD exacerbations and how to treat community-acquired pneumonia, and you're going to progress. And 6 months later of wards, you're expected to be able to perform at your 7th and 8th month. Now, there is a caveat for surgery prelims, is that there is a chance. In my program, I got into the OR all the time. Some programs, of course, I didn't go to every program, but some programs, you're just a floor intern. You're managing the pre and post-op patients and just seeing admissions and consults. So you're not really getting to operate. So if you're doing a prelim thinking you're going to get to operate, you would have to really evaluate that program for that quality, that characteristic. Now, last but not least, and probably the most sought after of these prerequisite years, the transitional year. So the transitional year, when you would do it, I think, is if you've already matched into a specialty. Actually, let me rephrase that. Basically, you do these prelims and transitional years based on what you want to learn. If you want to learn surgery, do surgery. If you want to learn IM, do IM. If you don't really want to learn much, that's frankly the truth about the transitional year. Transitional year, you're basically a glorified med student. You're doing 1 month of, 1 or 2 months or 3 months of wards. You're going to do 1 month of an elective that you choose, like derm or something like that. You're gonna rotate. You're gonna do OB. You're gonna do surgery. You're gonna do radiology. You might get a month of research. You're never, let's say you do a month of surgery, of gen surge. You're not expected to know how to operate in that month, right? It's a 1 month rotation. It's like a clerkship even. So you can get by with, I don't really know much, because you're a transitional year kid who's doing 1 month mixed bag. And historically, transitional years is where you work the least amount. The expectations of you are lower. You don't have to prove yourself because you've most of the time already matched, and it's basically like the relaxed version and the thing that kind of keeps you in medicine until you do your advanced specialty. That's what I've seen. I've seen TY curriculums that have a research month mixed in. I've never seen that in IM. I've seen it occasionally in surgery. I've seen like TY curriculums where you really could do like whatever you want. Like you could do surgery and then internal medicine. You could go the whole spectrum. Whereas if you do a prelim in internal medicine, they're not going to let you go into the OR. There's no rotation for that. I'm not going to have a curriculum set up for that. If you do a surgery prelim, you're not going to be able to do internal medicine. You're not going to be able to do an elective in nephrology or something like that for the most part. So, that's my opinion. The reason I specifically did a surgery prelim is because I wanted to be at a robust academic institution that had a radiology residency. So that's why I transferred to the university that I'm at, and because I was reapplying to orthopedics. So I wanted to have a surgical background. And even for radiology, the truth is the surgeon is closer to the radiologist than the primary care physician. Why? Because of surgical planning, because of post-op complications, and so often are we in the reading room talking to the radiologist about, our surgical plan. And so I felt like it was going to be more of an opportunity for me to get closer to radiology than an internal medicine prelim would be.